Bismillahirrahmanirrahim. Now we are just going to discuss the meninges and the sinuses. So, how many meninges of your brain and the spinal cord?
3.
Name them. Erectile matter and pia matter. Innermost is the pia matter, and the middle one is the arachnoid, and the outermost is the your dura matter. So first we try to cover the meninges of your brain, and then we enter into the meninges of the spinal cord meninges are very simple, but a little bit the discussion of dura is complicated. So we start with the meninges. So you know better before I come back to this. So let's see this. Here is the version of the section coming from your upper side skull. So what are after the hair? What is present at the first scalp?
Skin.
5 layers of scalp. So you can see, follow the diagram. Inshallah, you will easy. What is this first layer?
Skin.
So this is again. This is what connective tissue, and then here you know better the highly vascular, and under this is the aponeurosis, then the loose connective tissue, so periosteum. So these are the layers which are coming in front. So after this you will find the calvaria. Calvaria means your skull bone, in which you have one outer table, one inner table. So because it's in between, you find the spongy bone, and there is between the outer and inner table. So let's see what is happening. So this is your outer and inner table, and in between this is your diploid. Or so this calvaria is actually your skull, in which you have outer table and inner table. In between you will find the diploid. So here you will also find the diploid veins. So a little bit, it's not this picture is not present in your books, most of books. So students are confused really. So outer table, inner table, in between there is a diploid, and here you will find these diploic veins, as the name represents. So here is diploic veins. So these are your medial meningeal artery. Here you will find the medial meningeal. So that's why, because the epidural space, so epidural hemorrhage is related to this artery, medial meningeal artery, because you can see here it is present on the outer aspect. So this is your medial meningeal artery. Now come to the the dura and the meningeal layer. So here what you can see, this is here is the dura, because in the brain dura has 2 layers. One is the endosteum, or you can say periosteum, which is tightly bound with this your calvaria, or you can say your the skull bone, while the meningeal goes deeper and form your dural fold and then your sinuses. So we have to look at later. So let's see, here is your endosteum, dura periosteal layer. Here you can see this green color is your meningeal artery. You can see it is dipping down and forming the sinuses. So, and here is and forming the falx cerebrae. So as they dip down here, so they form the falx cerebrae. Falx cerebrae is present in between the left and right hemisphere, cerebral hemisphere. So this here the formation of your suprasagittal sinus on the superior aspect. So, and here you can see this one is your the arachnoid, and under there the black color representing what? So that is your pia mater, and you can see these granulation. Can you see here something granulation which are entering into suprasagittal sinus? So they are actually doing what? So the your CSF, which is coming from your ventricle system and which is flowing in between this here is you. So this is your subarachnoid space where you find the CSF. So CSF which is floating here, so they reach here and dip into the suprasagittal sinus. So their drainage of your CSF is in the suprasagittal sinus. Are you clear? So yes. So and here you will find the emissary vein. So this is your actually 3 meningeal 3 layers. Outer one is the dura, which has 2 parts, the periosteal and the meningeal layer. The periosteal is simple, attached with the skull. and the meningeal go deeper from the fold. So we don't confuse it. So I discuss later. So just see here, and then the arachnoid. Under the between the arachnoid and pia mater is your subarachnoid space. Between the arachnoid and the dura is the subdural. Outer side of your the dura is the epidural space. So there are mainly three spaces: epidural, subdural, and the subarachnoid. In the subarachnoid, major important is the CSF. So, and you can see emissary veins. So simply emissary means something messenger system which connecting. So can you see this emissary vein connecting your outside of skull, extracranial and intracranial? Here is because what is a Calvaria, and this part is considered as the extracranial part, and this is considered intracranial. So emissary connecting your extracranial part with the intracranial part. So these are different veins. So these are scalp veins, so veins coming from your scalp, so they are connected also. So that's why when someone there is a injury in the your scalp region, so they can lead into this suprasagittal sinus. So you can see the pathway of this. Here is your the other veins. So this vein is superficial cerebral veins or bridging veins. So can you see this? The superficial or bridging veins are those veins which are present in the intracranial, and they connect the intracranial drainage of the blood from the intracranial part to the suprasagittal, while the emissary veins drain the blood from the extracranial part. So clear these two terms, say emissary veins and the bridging veins. Bridging take blood from the intracranial part, while the emissary take blood from the extracranial part. Are you clear?
Yes.
So here is the other veins which are connecting, all they drain into these sinuses. So here is the arachnoid villi and granulation. So cranial epidural space, and there is important in the cranial epidural space. You majorly find you can see here here you will find these. Can you see these arteries? So their major importance is the meningeal arteries and veins are present here in the cranial epidural, because here is your the dura and outside there is epidural space. And you will find in the spinal epidural space there is important. So the epidural space in the brain is not as such important, only the arteries and veins are present, while in the spinal cord you will find the fatty layers outside in the epidural space. So we will discuss later. So lymphatic and venous plexus are present there. So in which you will find the anesthesia, put their anesthesia there. And I already discussed the arachnoid villi. We drain the blood CSF back to the bloodstream. So and there is the extradural hemorrhage. So important thing is which artery, which veins is the damaging. So in the extradural, what you can see here in the extradural space, what is present? Middle meningeal artery. So if there is extradural hemorrhage, what should be damaged? Middle meningeal artery should be damaged. So in case of the subdural hemorrhage, the superficial cerebral veins are damaging. So these are important things you need to note here. So subdural hemorrhage, where the superficial cerebral veins are involved, and the other thing, so because the meningeal layers, and so these meninges which periosteal layers remain connected with your skull, while the meningeal layer go back to the midbrain, pons, medulla oblongata, and enter into at the level of foramen magnum into the spinal cord. So this is continuous with spinal cord, while periosteal is not present in your spinal cord. Are you clear?
Yes.
Meningeal is present in the spinal cord, while they end up here. So only one layer of dura is present in the spinal cord, while in case of brain there are two layers: dura, the periosteal layer, or you can say the endosteum layer, and your meningeal, both are present. So let's see how these sinuses formation occur. So as you mentioned, for example, this is your the outer one layer, which is the periosteal layer, and here is your, for example, your the meningeal layer. So let's see, these are connected here like this. So what you can see, this meningeal layer, they are dipping down. As they dip down, what you can see, they are dipping like this. So on the lower margin, for example here, so one sinus formation occur here and other sinus formation occur here. Let's see here. So how the formation occurs here. So put it up here. So can you see these two markers? So they are actually showing two sinuses. So one is suprasagittal and the lower one is the infrasagittal sinuses. So in between this part which is connected, so this is your falx cerebri. So can you see the relation of your infrasagittal sinus and the suprasagittal? So this layer, which is the outer layer, you can see the outer side, this is a fixed part of your meningeal layer. So on the fixed margin, what is present? Suprasagittal sinus. On this free border, your infrasagittal sinus is present. Are you clear? So in this way, your the sinus formation occur. Actually, in the initial case, what is it? Like this. So as they dip down, they form the sinus as well as the cerebri, falx cerebri, or your dural fold. So these dural fold are actually involved in the formation of your sinuses as well as your dural fold. So other concept is that, so there is a lines in some books is present. So the some sinuses are formed by the two layers of your the dura. Some layers are by folding of the single layer. So can you see this is formed by the single folding of your infrasagittal sinus, while this is the suprasagittal sinus is formed by this upper layer. This is what? Periosteal layer, and this is what? Meningeal layer. So that's why some sinus formation occur by the both. Some are formed by the single folding. So in like your infrasagittal sinus. So we continue the remaining story. What is happening? So and your the optic nerve dura form complete tubular sheath around the optic nerve as well as the sclera of eyeball. What it means? So actually when you are the subarachnoid, which is going around the covering your brain and the spinal. These layer actually your dura and the periosteal, they are actually continuous with the covering of your nerve fiber. Like your what is covering? Endoneurium, perineurium, and the epineurium. You know better, last lecture I have mentioned these. So they are continuous with this perineurium and the epineurium. So but they end at the opening of your vertebra where the optic nerve comes out. But only the optic nerve, they take this complete sheath of these coverings, so till their end. So for example, the nerves is coming from your the upper margin of your the midbrain. So they came, and these covering also came with this nerve. So these nerves came and reaches into your eye, because the optic nerve going to eye. So these covering also continues with this. Are you clear what I'm saying?
Yes, yes.
So while in other case, only this optic nerve take the complete covering of your meningeal layer till the end of their effector, or you can say the innervated part. Are you clear? So while in other case they end after the brain and the foramen, after the crossing foramen they end up. Are you clear? So just remember, the superficial cerebral veins is associated with the subdural hemorrhage, while the middle meningeal artery is associated with the epidural hemorrhage. Just remember it. This is your subdural hemorrhage and this is your extradural hematomas. So what do you mean by hemorrhage and hematoma?
Hematoma means something clot. Hemorrhage means damage.
Hemorrhage is a clump, and here is the bleeding.
Hemorrhage.
One is a clump, one is the bleeding. So clear these two terms. So coming back, so can you see here? So one other concept we need to note, the dural and the dura arachnoid and regarding the pia. So dura is on the outer aspect, you can easily remove it. Arachnoid is when you see this brain, so this is your brain, and you can see this covering is actually your arachnoid, but the pia is tightly bound with your brain, so you cannot peek away. So when you follow the pia, they are actually going into the sulci, into the dura, so they are continuous with the sulci and gyri. But when you see the arachnoid, so like this, here is your sulci, so they are not going down, so they cross here, arachnoid crossing here, so they are not dipping down with the sulci and the gyri. So these are different your gyri, and in between there is the sulcus. So pia is continuous with this, while this arachnoid is on the outer aspect. So under the arachnoid, what is present? Subarachnoid CSF is present. So here you can see this arrow is going into the subarachnoid space. So where you will find the CSF and the superficial cerebral veins, as you seen already. So that's clear. So in this picture, can you see this is the dura, which is easily removed on the outer aspect, which is present under the scalp, and here you find this here is your folding of your the dura folding, which are dipping into the in between the cerebral hemisphere, likewise on the back in between the so that's why we name them fox, actually, because there is fox cerebri. So because why we are naming them, because there is other thing which is fox cerebelli, which is fold which is entering into the between the cerebellum. So one is entering between the cerebellum, one is entering between the cerebellum, and the other is the tentorium cerebelli. So tentorium means something tent like. Cerebelli mean this tent is over the cerebellum. So if you see like this, so for example, this is the tent of your tentorium cerebelli. So over there you will find this cerebellum, fox cerebri, and under this you will find fox cerebelli. Fox cerebelli is under here, so it is continuous, and why this the cerebellum is over this. So see this arrangement. So here you can see the fox cerebelli is here, while this the tentorium cerebelli is present in between, and on the back you will find this. Here you can see the the tentorial cerebelli, and what you can see here, the fox cerebelli. Are you clear? So these are actually arrangements. So dura and pachy, the other name for dura mater, the pachymeninx. So because it is a tough layer, pachymeninx related to membrane. So it is tough layers because already know periosteal, which is attached to the skull. So meningeal is fold forming, dural fold, you know better. Arachnoid, soft translucent membrane, translucent, you can see transparent type, so loosely envelop the membrane because under there is the CSF. So separated from subdural space, where you find the subarachnoid space. So from the dura it is separated by the subdura, while by the pia it is separated by the subarachnoid space. So fibrous trabecular. So actually in this subarachnoid, you will find the trabecular, fibrous trabecular structure like this. So in the CSF, where their CSF is floating, so these trabecular are present, in which you and the pia mater, it is the innermost highly vascular layer. So can you see here is closely adherent to the gyri and fitted into the sulci. Are you clear this term? So both the arachnoid and for pia, so because they are associated with the mainly the brain, so single name for both is used for the leptomeninges. So this is name for the arachnoid and pia for as a complex. So single unit as for pia and arachnoid. So and follow the contours as I mentioned. So the dura and arachnoid cover the brain, but does not follow the contours of its surfaces. So they are not going into the sulci and the gyri, while the pia is tightly adherent, so they follow the contours of your brain. So other important thing for the embryological development discussed later, but just remember the neural cross cell and the neural tube is actually involved in the brain synthesis. So while there is exception for the dura mater, which is coming, their origin is the mesoderm, while the P and arachnoid origin is the neural crust. And your microglial cells, they are also coming from the mesoderm, while all other things are coming from the neural crust and the neural tube. So there is other subarachnoid. In the subarachnoid cell, you will find some cisternae. Cisternae is actually, this is space, so somewhere they extend, dilated here. So these are actually called the cisternae. Just name them. So can you see here the different cisternae? So here is the cisterna magna or the medullary cisterna. So it is the inferior surface of the cerebellum and the back of your medulla. Here is your medulla, here is your cerebellum. So on the inferior margin, this is present. So while the CSF is present here, so ventricle via the two lateral aperture. So because when you see the ventricle, fourth ventricle, there are two lateral, one medial. So the foramina lusca and the foramina meningeal. Lusca is on the lateral aspect, the meningeal is on the medial aspect. So lusca is actually giving the supply of the CSF into these cisterns. And the other is the interpedunculaire, because it is present in between the peduncle of your midbrain. So here you can see these peduncles. Here is midbrain, here is the peduncle. So here is the other cistern. So these are actual deletion of your subarachnoid space. So you can see here. So it contains the optic chiasm and on the outer margin, and the circulus arterius of the villus. So these actually form the blood supply. When you see there is circle formation occur, so that is also associated here. So and the third and fourth cranial nerves are associated with this. All the cisterns communicate freely with each other. Here is the pontine cistern. So you can read this stuff. I am not going to detail of this. So there is another cistern lateral fissures. So all these are, just remember, there is the dilation of the subarachnoid space. So another important thing, the clinical shake baby syndrome. So where some mothers and the family members, so when they pick their child baby, they play with them. So sometime, because in the early age, so their meninges are not tightly, so they are weak. So that's why when you pull them, shake them, so you may cause this hemorrhage. So such kind of hemorrhage can be, or the subdural hemorrhage. So because in subdural hemorrhage, which vein is damaged? No, middle meningeal is the epidural. You know better. Middle meningeal is present on the near the skull, while subdural hemorrhage is associated with the superficial cerebral vein. So in the subdural hemorrhage, so you are actually clumping, they are causing the damage to that.
अच्छा, which age is कितनी एज तक ये इसकी ज़्यादा चांसेस होते हैं इसके?
Early 3 to 5 years of your life. So let's see the whiteboard diagram. So now look at it here. You know better. Let's see. This is your Pars cerebri. So this is your whole, for example, Pars cerebri. So on the upper side, what is present? Of course, suprasagittal sinus. You know better. And the lower margin, what is present? Lower free margin, infrasagittal sinus. So this suprasagittal sinus come here, and this infrasagittal sinus become straight sinus. So this is your straight sinus. This infrasagittal sinus form going into the straight sinus. Actually, straight sinus is formed by the infrasagittal sinus and the great cerebral vein. So they are coming right this point, and from at this point, which is called confluence of sinus, where these sinus coming here. So one the two transverse sinus, right and left, came out here. So see here. This is, for example, left, and here is the other sinus coming here. So they are called transverse sinus. So one is the left, one is the right. So these are paired, and they are coming here, and they become sigmoid, like with here. So these are called sigmoid sinus. Sigmoid sinus. So transverse is continuous with the sigmoid sinus. So this sigmoid sinus is actually going into the your intrajugular vein, internal jugular vein. So both are. So this point where all these sinus are meeting at this point, this is called confluence point. Confluence of sinuses. So you know better, other two sinuses are present. For example, your cavernous sinus. Let's see, these are the pair of your cavernous sinus, which is around the body of your saphenate. So they drain into these sinus by superior petrosal sinus and the inferior petrosal. So let's see, this is your superior petrosal, which is, for example, coming into the transverse sinus, and this is the inferior one. And likewise, this is going to this one. So these are what superior petrosal sinus and inferior petrosal sinus. Same like here, superior petrosal sinus, inferior petrosal sinus. So the cavernous sinus has lot of drainage. We will see later. So the major ones they are take blood from the facial veins by two pathways. One is the superior ophthalmic and the inferior ophthalmic. Superior ophthalmic vein and the inferior ophthalmic vein. So likewise here, same thing. So this is actually a simple story of your sinuses. So a lot of importance regarding the cavernous sinus. So what you can see here, the same picture as I mentioned in the whiteboard. So this is your suprasagittal sinus, and here is your infrasagittal sinus. So this your straight sinus, can you see here, straight sinus is actually formed by the infrasagittal sinus and this great cerebral vein. So these two veins actually unite and form this straight sinus, while the suprasagittal sinus is coming here. Actually, your suprasagittal is mainly drained into right transverse sinus, and your the straight sinus is continuous with the left transverse sinus. Particularly, so you can see here the transverse sinus right and left, and you can see this is cavernous sinus 1 and 2. This cavernous sinus by the superior petrosal sinus and the inferior petrosal sinus. So they are draining into this transverse and the sigmoid part of your sinuses. Can you see here? So and on the posterior aspect, you can see this is the occipital sinus. Can you see? This is occipital sinus, which is draining into this sigmoid sinus. So spend good time with this, you will clear. So now see this picture. It is schematic picture, which is not present. I have arranged in a different book. So follow this picture. It will help you a lot of question answer. So let's see. This is your skull. Are you clear? So here is your. No, it's cut section. So here is the foramen magnum. You can see here the foramen magnum. And here is your Here is your crista galli on the these are actually part of your ethmoid bone. So when you see when different terms which are when you read in the book, you will find the suprasagittal sinus is connected with on the interior margin with this crista galli. So this is crista galli, and here is the foramen cecum. Very clear. So everything is coming like a schematic version. Go through this animation, you will answer a lot of questions. So here is this is suprasagittal sinus. Can you see here? So on the like this suprasagittal sinus, which is continuous with the transverse sinus. So no, right and left, right. So this is so continue, and here is the infrasagittal sinus and which is forming the so this is superior sagittal sinus. So this sagittal sinus is how their formation occur by two part. One is the infrasagittal sinus, other is the great cerebral vein. So these are actually two are forming this sagittal sinus, and here is the infrasagittal sinus and the great cerebral vein. Number 2 is the great cerebral vein, while the number 1 is the infrasagittal sinus. They are forming this straight sinus. And here is your right transverse sinus, which continues with the superior sagittal sinus, as you can see. So here is the left transverse sinus, which continues with the straight sinus. So everything is very beautiful in this picture. And here is your sigmoid sinus, which is after the story of your transverse sinus. So which is continuous as the jugular vein, internal jugular vein by the foramen, jugular foramen. So this is what? This is your jugular foramen. Very good. So now see different view. I remove this and to see the inner margin, what is happening. These are your cavernous sinus. So in which you find the different veins which are draining into this cavernous sinus. Let's see. So here is the superficial middle cerebral vein, and on the lower aspect there is the inferior middle cerebral vein. So these are actually, when you see the communication, there are 1 or 2 pages maybe present in your book. So see here, you will answer that. Superficial and inferior middle. So they are also, here is what they are actually on the parietal margin of your saphenoparatal margin. There is other sinus, saphenoparatal sinus. So this is what, once again. So this is saphenoparatal sinus, and the sinus which connecting these two sinus, the cavernous sinus, that is what intercavernous sinus. So these are what, one is the interior, one is the posterior one. So posterior intercavernous and the interior intercavernous sinus. So here is what, here is the central vein of your retina. So vein taking blood from the retina, so they also drain in here. So here is what, another, there is the superior ophthalmic vein and the inferior ophthalmic. Because I am saying this, there is superior, mean there is something which is the inferior one. So here is your so this is what, this is your inferior ophthalmic. So these are taking blood from the facial vein. So important thing is that there is a line in your book, the inferior ophthalmic may directly drain into the cavernous vein, or they may enter into superior ophthalmic vein. So in this picture, what you can see, the inferior ophthalmic is entering into the superior ophthalmic. Can you see here? This inferior is entering into the superior ophthalmic, then it drain into the cavernous sinus. While some cases this directly drain into the cavernous sinus. So they are taking blood from the facial vein. So when there is a cavernous thrombosis, what will happen? There actually blood is coming, the facial blood, which is coming from this dangerous area. So entered by these superior ophthalmic and the inferior ophthalmic into the cavernous sinus. Cavernous sinus is draining into actually these sinuses, superior sagittal and other sinuses. So that's why there is a problem when there is a damage in this dangerous area. Are you clear? So can you see this pathway? So these are other emissary veins. So they are taking likewise in the superior sagittal. Here is also emissary vein which is taking blood on the side. So they are also draining here. So these are the internal trunk of middle meningeal vein. So they drain here. So go through. This is what. Let's see. This is what, which is actually taking blood from cavernous sinus into the sigmoid sinus, or you can say that this is your petrosal vein, superior petrosal sinus and the inferior petrosal sinus. Can you see here? Continuous picture. Cavernous sinus draining into this sigmoid and the transverse part, and the inferior petrosal sometime they may drain into segment, sometimes they may drain into the internal jugular vein, because you can see here they are meeting at the jugular foramen point. Can you see here? So everything is beautiful manner. So go through this picture, you will answer a lot of questions. So here is your basilar venous pellex. So they are taking blood, the inferior petrosal. Can you see this inferior petrosal? So actually they are taking this blood here at the level of your vertebra or your foramen magnum. So they drain this blood into these inferior petrosal sinus. So the inferior petrosal is coming into the sigmoid sinus or into the jugular vein. Are you clear what I'm saying? So this picture is, so let's see the complete picture, which is here. On the superior margin is the suprasagittal sinus, on the back is the occipital sinus, and the occipital sinus is, I think, is not mentioned. So this part which is you are saying here in between is your tentorial cerebelli. So this part and this part in between them. So, and this is what on the back of that is the occipital sinus. So this is actually arrangement of your complete skull drainage. So major discussion of today's lecture is the sinuses. So you just remember what sinuses are paired, what are unpaired. You can see here. So your superior sagittal is the unpaired, and your transverse are the paired one. You can see one is here, one is here. Likewise, sigmoid is here, one sigmoid is here. Your cavernous is here. They are paired. Intercavernous are paired. So the saphenoparital is paired. So you can enlist them. Which one is the paired? Which one is the unpaired? So this is what, this is thrombosis by the blood is by the facial vein, ophthalmic vein, superior and the inferior. So your orbital veins, they may also came into your the cavernous sinus. So very important thing. So in some cases when you are there is a cancer or the tumor in your pituitary gland, so because these cavernous sinus are present on the lateral side of your sphenoid, and where you find in the hypophysis, or you can say pituitary gland. So when there is a tumor in the pituitary, so they may damage this cavernous sinus. So they may lead to these problems, such kind of complications you can follow. Are you clear?
Yes, sir.
So these are actually the picture stories. So how their blood is coming, superior is come into the right, inferior into striate is going into the left transverse sinus, and the occipital is sometime into the internal vertebral venous pellex, and the ophthalmic and saphenoparital in the cavernous sinus. So this is actually all the arrangement we have discussed. So go through this picture and last picture, you can clear on the drainage of your brain. Here is the other picture. So now let's see the relation of your fold and the sinuses. So let's see. Here is your periosteal layer, which is connected with your skull, while the meningeal is forming the fold. So let's see the fold formation. So these are actually fold. Can you see here? One is here, one is here, here. So these fold. So let's name them. So in between, what is present? Sinuses. So due to these fold formation, fold is also forming. So fold actually prevent when I move like this, so my brain is in the position. They are not changing their position because of this.
Protect from acceleration.
Yes, pressure or so a little bit. So there is a limit for everything. After the limit, you may cross this. If you cross the limit of their pressure, so you may damage your brain. So these are your sinuses. So here is your dural meningeal. Here is your cerebral hemisphere, and here is the cerebellum. What is this fold? My request, answer this fold. So let's see. So this is what? Falx cerebri. And here is what? Between the cerebellum and the cerebrum. Tentorium. Very good. So tentorium cerebri. So the part which is above the tentorium is the supratentorial, which is below the tentorium is the infratentorial. So it is easier. What is supratentorial? The cerebellum. What is infratentorial? Is the cerebellum. So you can see this is what? Supratentorial and the infrared tentorium in this picture. So let's continue the picture. So here is what on the back say falx cerebelli, and let's name them. This is the which sinus? Superior sagittal sinus or suprasagittal, whatever you. So this is what on the side is the transverse sinus. So here is what on the back the occipital.
Sinus is a paired sinus.
With the transfer, yes, right and left. So and this is what the occipital sinus. So and the at the mid, what is present in the striatum, because they are taking this section right here. So that's why you find the striatum, which is taking blood from the great cerebral and the inferior sagittal sinus. And you will find another thing, important thing, which is maybe present, maybe not. You will find. So this tentorial, because you know better the cerebellum. There is cerebellum in front. What is going? Midbrain, pons, and the medulla oblongata. So we cannot we cannot completely close the tentorial cerebellum. So we need a notch or opening through which these part, midbrain, or you can say pons, medulla oblongata can cross. So there is a notch in the tentorium through which this medulla oblongata, your pons, your midbrain are crossing. So that notch is name is the tentorial notch. Are you clear?
Yes.
You will maybe picture present, maybe not. You will find in the books. So there is tentorial notch, which is for the path opening. There is opening for the midbrain and the pons and the medulla oblongata. So this is cavernous sinus. You can see different part which are draining into here. So it is complicated version. That picture is very good. So this is the extra explanation. If you can see, you can there everything is mentioned. You can go through it. I'm not going to detail. And you can see this picture, which is related to our picture. So occipital sinus. So confluence of sinus here, where the all sinus are meeting. So now come to the story of the difficult story of the brain and the meninges and fold we have covered. Now come to the spinal. Everything is in a beautiful manner. So you know better everything. I'm just going to little bit detail. So this is your actually two enlargement. One is the cervical, one is the lumbar. Cervical is for the brachial plex, lumbar is for lumbosacral plex, which is going to supply your lower limb, and the cervical is going to supply your brachial plex, upper limbs. So mean these two are related with the limb supply. So let's see, this is what spinal cord. So this is ending at the level of L1 and lower border of L1 mainly. So L1 and L2. Let's see, this is first covering. What is innermost covering of pia mater, of course. So this is pia mater, and because it's ended at the level of L1 and L. After the L1 L2 is no, that is outside. I'm discussing something else. So after the conus medullaris, where the spinal cord end. So after this is continuous. Your PI is continuous. So after the continuation of this part, you can see here. So this line which are you saying, this is which is attaching at the coccyx. This is phylum terminale. So this part, how can you define phylum terminale? The extension of pia mater after the conus medullaris, simple. After the conus medullaris, the extension of pia mater is the phylum terminale, which is attaching. Actually, it is like this. So they are actually giving strength. So they do not allow the spinal cord and the damage. So they are fixing like this. So they're actually fixed like in the vertical direction as well as the horizontal. So both the vertical and the horizontal are actually associated with the pia mater. So there is other denticulate ligament we will see later. So they actually give fixation like horizontal way. So here is what the other layer after this is arachnoid. So this part is which is subarachnoid. Very good. So it is ending at the level of S2. So your pia is continuous at the level of coccyx, while this is what arachnoid and subarachnoid. Here is what the dura better, and this part which is under the dura is the subdura, outside the dura epidural. So epidural part and this is epidural part, and this is the under is the subdural. So both are ending at the level of S2. So your the dura and your arachnoid end at the level of S2. So can you when you see the lumbar puncture, so that is good side we because our concern with the CSF, not with the spinal cord. So that's why we use best way between this L1 part to S2, that is safe zone where you can put the needle to take your CSF. So better way one is the epidural or you can say the epidural anesthesia is put at the level of the L3 and L4 between the one is the on the upper side of your L4, one is on the lower. The epidural anesthesia is put above the L4. Your subdural anesthesia is put in the below the here you can say subarachnoid, or you can say, so that is put below the your L4. So major part is the L4 level. So you can define the major the level of your L4 by putting your hand like this. So iliac crus. So if you follow this line, so they are actually where they unite, the vertebra is actually your L4, L3 and L4. You are reaching in between them. So these are what these are ligament, denticulate ligament, which are fixating like that. So you can see the PI is giving support in vertical direction as well as in the lateral or horizontal direction. So you can see here. So these are the denticulate ligament. So you can put, when you put this needle or anesthesia, so important thing in the step 1, they ask, so what is pathway? You are crossing your skin, you are crossing your different sinuses. So let's see. So you are crossing your skin, superficial fascia, and you are crossing supraspinous ligament. So because on the back what is present? Not body of vertebra, spinous of your vertebra is present. So there is a supraspinous, there is a intraspinous. Supraspinous ligament is outside the outer margin, and in between this is the interspinous ligament. So there ligament of your vertebra actually. So ligamentum flavum. So when you put these lumbar puncture or spinal anesthesia, you are crossing all these layers. So then these meningeal layer come. So first skin, superficial fascia, supraspinous, infraspinous, ligamentum flavum, then these 3 meningeal layer. So we are not touching the pia mater. Can you see? So we are actually concerned with the subdural. So pia mater is intact. So you can see here. So this is actually your level. So the here iliac crus, you can define the level of this. So L4, so L3 and L4 space, and the L4 and L5 is for the epidural, and for the other lumbar puncture or spinal anesthesia, one is above, one is below. So here what you can see here, spinal cord. So in between what is present, there is a fissure, that is the interior median fissure of your spinal cord, and what you can see other thing, this is pia mater, and these are the denticulate ligament. You can see this picture. So when you, inshallah, I hope so, here is some neurosurgeon. So when one day you will see such kind of picture. So arachnoid mater, dura mater, and here is what the spinal blood vessels of your, and here is the one is the dorsal root, one is the ventral root. Ventral root is concerned with the dorsal root is concerned with the sensory, ventral root is concerned with the motor pathway. Or your sympathetic also came from your the autonomic, they are also coming from the ventral root. So these are epidural anesthesia and the spinal anesthesia, you can see here. So spinal dura mater, dorsal root, denticular ligament, dorsal column of your this white matter, and the arachnoid and the spinal cord. So last the clinical associated with the meninges is the meningitis. So we are Meningitis, they are actually different inflammation. It is actually inflammation of your the leptomeninges, so or you can say PMater and arachnoid. So that is an inflammation. So I'm not going to detail of this. You can read by your own. So just remember what is the my area of interest is here, CSF finding. What is your CSF when there is the bacterial? What is the CSF finding when there is the viral? What is CSF when there is a fungal? So you can read, it's easier. So 2 points, maybe you find some kind of knuckle rigidity. Knuckle rigidity, it is associated with the neck. When you the patient of the bacterial meningitis, you can easily do it. When you try to pull like this, so when you pull their neck back, so there is a difficulty. So they do not allow this. So such kind of this condition is called the knuckle rigidity. Other thing is the Carnage. So actually, when you try to the flex the patient hip, so you and cannot extend the knee. So when you try to extend their knee, so it's a lot of painful condition. So maybe it cry there in the hospital. So this is actually the Carnage signs. So they are actually defining your meningitis condition. So and the immunization which in the early life is used, the Haemophilus influenza has significantly reduced this type of meningitis. So these immunization are very important, or you can say vaccine. So what is the CSF finding? There is the numerous polymorphonuclear leukocyte. You will find the leukocyte number of the leukocyte nucleus is going to increase. So and other thing, your glucose level is going to as compared to normal is going to decrease, and other less and protein high, and your leukocyte, they are numerous polymorphonuclear leukocyte you will find. So these are actually fine, you need to regard. And the other is the viral. So you can, my area of interest is in this your glucose level is normal and the protein is, or you can say normal or little bit higher as compared to. So just compare all these conditions. In the bacteria, what is happening in the viral is, so in the viral glucose is normal, but in the viral glucose is normal. In the fungal glucose is normal, where is low in the bacterial, and the protein is high in the bacterial. Here is normal, or you can say little bit higher, but if there is protein level high, you can go through the bacterial meningitis. And the numerous lymphocyte, here is the leukocyte and here is the lymphocyte, are going to increase. So these are actually finding